because that company was making so much of profit, billions of money on this one drug alone, but yet they decided to close. But we are not even comfortable, banning those drugs. So you should understand how serious it is. And we have a natural painkiller now, Ganoderma, which is able to help us in all these painful disorders, including cancer pain. It can control. But only thing is, it takes time. It takes about 6 weeks or 12 weeks to have that pain-killing effect. But I'm sure that most of us are not willing to wait till such time. And we want our doctors to give painkillers by injection. Immediate relief. Very powerful and dangerous poison by needle. Of course, if it's a pain is so severe, you have to take it. But please see that you are avoiding all such painkillers. Never take any painkiller without the medical advice. Never. Don't go to a pharmacy and say that you need all these drugs. Give me one nice or Nimulid or all these painkillers. They are very dangerous, and so many pain-killing drugs are under surveillance. They have not approved certain painkillers in US. FDA has not cleared certain drugs. As a trial basis, they have allowed 2 years or 3 years of their use. All this coxib, the Roficoxib, that's banned, then Valdicoxib, then so many drugs. So don't use that. You have an excellent natural painkiller. And this anti-inflammatory action of Ganoderma has been found to be effective in controlling two of the very bad, very serious brain disorders. One is Alzheimer's, other is Parkinsonism. They are very debilitating chronic diseases. It makes you, very incapacitated. You can't move around, you can't walk, you can't, your mental faculties also affected, especially with Alzheimer's. And in the University of Texas, they have done a study, and they have found that Ganoderma can help in these patients. I have a patient with Parkinsonism who has improved with Ganoderma. Of course, she is on other drugs also, but she has improved. Today morning, she is the bank manager's wife. He called me today morning, and doctor, where are you? Can I come and take RGGL from you? So I said, I'm in Thrissur. I'll come only on Wednesday night. I'll give it to you on Thursday. So I told him, you become a member and you buy the product. He was not willing. I don't know why. So he's my very close friend and very sincere patient, and the Ganoderma is able to help them. And especially in the brain, it does a lot of things, a lot of good things. And we have a neurologist in Chennai who is my student, Arjun Das, Deepak Arjun Das. He prescribes RGGL left and right to all his neurological patients, left and right. He gives a prescription. He is so much convinced about Ganoderma. So we can't do anything, we don't do anything without evidence. Whatever I talk, it's all based on evidence and research. I cannot talk like a person who is coming on the TV at 10 o'clock in the night or 11 o'clock in the night. You must understand, there is so much of scientific information is available, and it's up to you to know. For that, please don't research on Ganoderma. That is not required. Let the researchers do it. You don't worry about it. You just get the information and convince yourself. You have some basic knowledge about Ganoderma. Tell your friends and ask them to use it. That's it. Don't do any research. And the other effect of Ganoderma is this anti-cancer effect. And Japan, they have discovered this in Japan. And Japan is the only country which has declared Ganoderma as an anti-cancer drug. The federal law there in Japan, the drug authorities have said that it is an anti-cancer drug. No other country has declared that. And it can be given to any form of treatment, and the polysaccharide fraction has got the highest effect of this anti-cancer drug, property. And all of you know that cancer is a very deadly disease. It's a death warrant. If somebody, said to have a cancer, diagnosed to have a cancer, it's a death warrant. But at the same time, you should understand that there are certain cancers which can be totally cured. There are certain cancers which can be controlled for 10 years, 15 years, 20 years, 30 years. I can give examples. Prostatic cancer, colonic cancer, breast cancer, some of the leukemias, lymphatic cancers. They have an excellent remission. And my testimonial, my first testimonial was in cancer, a patient suffering from leukemia, monocytic leukemia. It happened in 1999, before the DXN started his business here. And that time Dr. Clarence had come. Dr. Lim sent Clarence to India to open up the market. He tried a couple of times earlier, but he was not successful. And Clarence being Clarence Stanislas, he has done a lot of research in Ganoderma. He is an MBBS doctor, Dr. Ratna's classmate. And Clarence's wife is Dr. Ratna's roommate.